Tonight we're just going to be taking a deeper look into the most recent Ebola outbreak in the United States and the ethical implications of the media reporting on the outbreak and how public health plays a role. So pictured you see a number of infectious diseases that cause high mortality rates, lots of deaths. We fail to report on cases that cause thousands of deaths in Americans every year. Yet we feared a disease that caused only one death within the US. What stimulated that fear? These intense fears came from the media reporting on the outbreak. There were a lot of reports that had misinformation and reporting on unnecessary aspects of the outbreak, which further fueled public panic. For example, on August 10th, Yahoo News reported, breaking, Ebola outbreak in Atlanta. Estimated 145 people infected so far since doctors carrying the disease were flown in from Africa. However, up until this point, only 2 people had been flown into the United States, a doctor and a nurse. They were flown out of West Africa to the US to seek treatment for Ebola.
Ebola. World goes on red alert. When Ebola arrived in the US, media coverage boomed, and the world instantly began to pay attention.
Stop the flights. This illustrates how stigma and fear was created among that community.
Ebola is real. Burn all. Reported by Inside News. Yes, Ebola is real. However, just because someone is suffering from an infectious disease does not constitute any means for bodily harm or statements justifying its behavior. This slide is overwhelming, and it's a lot to digest. But this is exactly how the American people felt when they first heard that Ebola hit US soil. And it's probably how many of you in this very room felt when you learned of Ebola coming to the United States. So these are just a few of the headlines and images that the media used to illustrate Ebola to the public. How can someone digest and retain the appropriate information when they're constantly being bombarded with opinion and comments? So this leads us to the purpose of our study.
The purpose of our study will focus on individual privacy and the rights of the media to report on speculated cases of Ebola. Based on this past Ebola outbreak, now we are able to develop a plan for future reporting of infectious diseases. Our plan will include a set of ethical guidelines that are based on the past media coverage of Thomas Eric Duncan.
According to Google Trends, the world only really started paying attention to Ebola as soon as it involved US patients. As you can see, this chart illustrates America's interest in Ebola over time. There are only 2 points in time in which Ebola was most prevalent in the United States. The first being August 2014, and that corresponds to the US missionaries Dr. Kent Brantley and nurse associate Nancy Wright-Bold being flown out of West Africa to the United States for treatment. Now, prior to the missionaries coming over, we heard reports from public health officials stating to the public that there was no need to worry about Ebola. It was never going to come to US soil, because we had the proper infrastructures in place in order to ward off the threat of such an infectious disease. So when the public began to hear such reports, their interest in Ebola, their fears in Ebola began to decline, as you can see in the chart. However, interest in Ebola began to spike back up again towards the end of September, early October 2014, when the media began to report that there was someone infected with Ebola in the United States. And as you later find out, that person is Thomas Eric Duncan.
Thomas Eric Duncan was infected with Ebola before his arrival to the US from Liberia, where he was planning on marrying his fiancée, the mother of his child. Prior to his departure, he had helped his Ebola-infected neighbor who was unable to transport herself to the hospital. Despite this act, we saw that the media portrayed Duncan as a malicious and scary man who was fleeing from the current outbreak that was occurring in Liberia. And ultimately, this led to the controversy surrounding his entrance into the US. So here we have Duncan, who boarded a flight to Dallas, showing no signs, no symptoms of Ebola. But indeed, he was infected with Ebola. However, despite how he contracted the disease, despite if he knew or whether he didn't know that he did not have the disease, he landed on our soil. He came to us. So he deserved to receive the same level of care and also, most importantly, the same level of privacy that anyone else would.
We will take a closer look at a timeline developed by the Associated Press that explains the events that led to Duncan's death. bringing closer attention to September 28th, when Duncan returned to Texas Presbyterian Hospital for the second time to seek treatment because his symptoms were worsening. He was in the latter stages of Ebola. Prior to this, America wasn't really concerned with Ebola. They didn't find it a threat. Why is that? Well, we had two cases. We had Duncan, who came to the U.S. with Ebola, and we had missionaries who came to the United States with Ebola. I apologize. Why is that a concern when we have two different cases but the same illness? Well, this is the issue. The missionaries coming over for treatment was a planned process. The United States public health system had a plan in place to contain an outbreak if it were to occur. They did not expect an outlier. They did not have a plan in place for Ebola to come in unexpectedly. So this kind of created sort of an obsession with the media. They started to report on any and everything that had to do with Thomas Eric Duncan and the Ebola virus disease, not thinking of the implications that it would have on exposing one man's identity. We learned far more information than what was needed. We learned about Duncan's address, his family information,
medical history and immigration status,
his occupation, the purpose of his travels,
where he was receiving treatment, and his age. As you can see all this information we just gave you, we see that the media is a very powerful outlet for disseminating information. Considering that 90% of the American public gets their news from mainstream media, it's obvious that news anchors inherently have the power to mold the public's response and their opinion. And in Duncan's case, the media had a lot of influence over maintaining a situation of calmness or creating a situation of frenzy.
This situation of frenzy can be explained by the mental noise theory. The mental noise theory states that once an individual is in a chaotic state, their inability to process, understand, and retain information is disrupted. So when CDC stated, like they said earlier, that Ebola is not going to be an issue, it will not be something where your household will be affected, and then Duncan's arrival, that completely changed everyone's ideas. The media went ahead and started increasing their reporting on Duncan and on Ebola, the frequency and large amounts. So the ability for people to understand true information once it was coming to them was extremely difficult. So for example, statements such as Ebola is a rare disease translated as Ebola is a disease. Or another statement, Ebola can be transmitted through bodily fluids was translated into Ebola is transmitted. 20% of information the individual is able to retain 20% of that information. So 80% is gone. And 80% is a lot of information to be gone.
So in the event of an infectious disease outbreak such as Ebola, officials from the public health field should prepare and implement an effective and unified response. They should be able to reduce harm and protect public safety, taking a utilitarian approach, protecting the greater good for the public. Now, the mainstream media, they do have the role of releasing information to make the public aware. However, as you saw in previous images, it appears that their main motivation was to boost ratings and compete with one another to be the first to report on anything and everything related to Ebola.
Just because the media has that information, is it okay for them to disseminate that information? Public health officials must provide timely and accurate information to mainstream media so they're able to target a wide audience. This is why it's necessary for ethical guidelines to be in place so both of these units can come together and provide information timely, accurately, and in large amounts.
So as Ayan stated earlier, the mental noise theory helped us to understand and develop this set of guidelines to implement in a future infectious disease reporting. To help create this middle ground between public health and media professionals, these guidelines will encourage collaboration, but they'll also encourage ethical reporting and moral reporting of the news. We went ahead and compared some of the current media code of ethics to our suggested guidelines for the future. If we look at the first media code of ethics, it says respect private grief and personal privacy, which aligns with our first guideline, which is more specific to the disease, stating respect for the rights of people living with Ebola virus disease or the disease in question. If you go down to the third media code of ethics, it reads minimize harm, show compassion for those who may be affected by news coverage, and consider cultural differences in approach and treatment, which aligns with our guidelines stating there should be no discrimination linking the disease to a particular community, ethnic group, or ethnicity. Digging a little bit deeper, we wanted to focus on two specific guidelines, the ones covering respect and discrimination. As far as Duncan's case goes, we felt that these two guidelines should have been adhered to, and in the future, if there is a similar situation to his, these two should specifically be focused on. The first guideline, showing respect for the rights of people living with the disease. This guideline encompasses the privacy and portraying the facts rather than speculated information. The media and journalists also have the responsibility to respect the individual in the news. And not only that, but they need to remain accountable for what they're putting out there, what they're reporting, to make sure it's accurate and it's fair information. Second, there should not be any discrimination linking the disease to a particular ethnic group, community, or country. With Duncan, we saw that the media had several repercussions with his community. We saw that his family was affected, individuals traveling to and from West Africa were affected, West Africans were affected, and to a certain extent they were stigmatized, and also healthcare workers involved with Duncan and in the entire process were also affected.
Each community that Duncan represented was impacted by the media's role in reporting. Those who identified with being of that West African culture were turned away from employment, denied access to school, and also Duncan's family. They resided at the Ivy apartment complex in Texas. Think about the discrimination that family faced within the complex and the stigma tied to those who just lived near him, all because they were his neighbors. Think about the financial burden that the complex faced just because of the media's exposure. Would you want to live in a place where Ebola existed? Think about Duncan's fiance. How do you think her coworkers or employers responded to that news? Also, Duncan's children attended school in Richardson Independent School District in Texas. What type of bullying do you think that they faced while trying to go to school for an education? Would you allow your children to attend school with Duncan's children? Duncan's case is a prime example of why we need a clear and ethical pathway in the reporting of a disease outbreak in the future in the U.S. So we thank you so much for your time, and we will now open the floor for questions.
Saying proud of you guys, great job, whatever program you guys are from. So when it comes to the use of social media and how everyone's got a camera, everyone's looking for the story, how are you guys going to control some of the more outliers who are out there running around, I guess almost night crawling of sorts, with those kind of stories?
There's no way we can control that. That's why we hadn't explored the policy level yet, to say that this is a must and this is how it's going to be. We really were using these as suggestions to use in the future where, for example, the CDC or the World Health Organization could work in a faster way, work in a timelier manner to go to these media outlets and say, this is how we're going to report, this is what we're going to report. As far, for example, the clip that Susan read to us from Yahoo, that tweet, Yahoo had no risk management, so there was no retraction of that statement. So in cases like that, if it's a news outlet, there needs to be some sort of risk management plan where information that is completely false should be retracted, and there should be some sort of cleanup for that situation. But as far as you and I tweeting or you and I posting on Facebook, there is nothing we can do to control that.
I just want to create a basic infrastructure, something that we can refer to in it.
So you discussed accountability and responsibility for a media outlet in this particular case or in cases of disease outbreaks. that may target a specific group. Did you look or research any of the accountability policies regarding accountability to these different media outlets? So in regards to like the news stations that you quoted or the headlines that you quoted, were there any policies in place for accountability?
Not that I found, and I didn't explore that. I should have looked into that, I guess, but I didn't go into that. I mean, the media code of ethics that's out there is suggested. So there really is a lack of monitoring what people are saying on the news. For example, one of the images we had saying Ebola, the ISIS of diseases, that's completely far-fetched and it's a scary statement. So, you know, it's not adhering to that code of ethics where it's creating that fear. So that's really a suggestion, but we didn't really explore that accountability aspect.
And just to add to that, a lot of, especially major news outlets, they have their own policies and procedures within their own organizations. So I looked into it and it was really difficult to find. So I guess you would have to be employed by that news outlet, but the media code of ethics explains, just like she said, suggested items, but it doesn't necessarily mean you have to follow those.
Thank you very much.